One of the first recommendations I have to try to help you stay efficient while using Millennium and PowerChart here is to push out the sections here that you see for subjective, review of systems, objective, physical exam, and assessment and plan. I also like to push out this patient instructions thing so that they're on the right side of the chart. That way I can independently look at all the different parts of the chart, like the patient's medication list or what have you, while I'm still making the note. If you haven't done that, the way to do it is to find the section here in the component workflow that you want to push out to the right. So for instance, in this case, I'm going to push out the patient instructions section, and I find this little arrow here and I just click it, and that's going to push it out. It'll do it in the order in which you did it. So basically most of us like to do our notes in this order. So first you would do the subjective, then you would do the review of systems, then you do the exam, and then you do your assessment and plan. And then if you like it like I do, you can do this at the end. The next general piece of advice I have to increase your efficiency is to try to stay on the M page itself when you're doing your workflow and creating your notes. So just a refresher, the M pages are these things at the top. The ambulatory workflow, there's one for postpartum workflow, there are M pages for quick orders and so forth. But I want you to try to focus on staying on your ambulatory workflow page when you're creating your notes. So the best way to do that is to set up your components, which are the individual pieces here, in an order that works for you. Get used to going back and forth through them with the clicking on the left and learning how to set up the filters. So the documents is the best place to show you what the filters means. Documents here, you look at a note and often you will see tons and tons of notes. And this is a test patient, of course, so you see all kinds of notes on here. But it can be often a lot of different notes that don't mean anything to you. When you use these filters, though, you can show the notes that you wanted to do. So for instance, there's a filter here to show the family practice clinic notes. And I also have turned on the ED provider notes. So when I have those filters turned on, it's just going to show me those notes. And then I can relatively easily come back and look at a note from August 27th, the last time I saw this patient. I can look down and see what's going on, what happened, and then I can close that. So I can look through the documents pretty quickly. You'll see there are components for labs and showing you the lab results, and there are filters for this also. And so try to get comfortable for that and try to stay within the workflow as much as you can. So a few things that you do end up needing to go to the dark menu for, often to go to the medication list to do prescriptions. Sometimes you do need to go out to that results review to see lots of labs or to compare old labs. So those are two things that we go to fairly often. And then of course to see things that are scanned in, you really need to go to the notes section. But other than those three things, typically you want to stay right in your workflow. One other thing I know that's in the dark menu that I use a lot is the growth chart when I'm doing my well child checks. But the final thing to say about staying in the workflow is this new order component. And so when we first put together the system, we really flaunted this quick orders M page here. And that's okay if you're really good at it and you're really efficient. It's certainly okay to use. But you may find that if you set up your favorite orders here, you can order them right from your workflow. So this is back on the ambulatory workflow, the new order component. And I can search for orders here. So if I type in XR, I get all the X-rays. If I type RIG, I get all the right-sided X-rays. And if I type it KN, now I'm going to get the right knee X-rays. So with just a couple of letters, I got down pretty quickly to what I'm looking for. I can also access all my favorites by clicking either the RX meds or the in-office meds and then going to the mine. And these are my favorites. So for instance, I have my favorite labs set up here under physical, and I can pretty easily order them just by clicking on them. And that just puts it right into the shopping cart up here. So we'll go into a little bit more detail on how to set that up later, but these are things that you can do by staying right in your workflow. The reason this is nice, let's say I come in here and I try to start ordering something and I realize, whoops, I haven't gotten my assessment yet. I can easily just jump up here to problem list, add my assessment, just hop back right back to the order right where I was. So this will increase your efficiency. All right, so let's get into the nuts and bolts of actually making your note. Let's start at the top of the note, the HPI or the subjective section, and we have our little box here for doing this. Most of us are making our notes by using the little boxes. You can, if you want to, actually just create your note and then actually do your sections of the note in the individual sections. I think most of us find that it's a little bit more efficient to do it here in the workflow and then create the note at the end and make any changes if you need to. So that's how I've been doing it, and I'm pretty happy with that approach. So let's take a look and see how it looks. So for the subjective, there are a few different ways that you can build, of course, each of these sections, but specifically for subjective, let's take a look at some of the options. So one of the things you could do is you could use an auto text. So for instance, we built a lot of auto text for family practice, such as this FP, HPI, URI. And so I can drop this in. And now I can use this with my drag and auto text, and I can navigate through the brackets by using the forward arrow button. And the way these are designed to work, you should see here it says patient complains of, and then there's a lot of different things here. So what I would do is push the forward arrow on my microphone, and that now highlights this whole section of the inside the brackets. And then I would turn on my microphone and I would dictate something. And since everything in the brackets is highlighted, it's going to erase it and put what I say. So all these things in here are kind of like a general recommendation of what you might say. So I'm going to turn on my microphone, cough and congestion, and you'll see that it replaced that. Now I can go to the next section here, which is the onset and duration. So it says days, weeks, months, years, acute, chronic. Obviously I'm not going to use all those things, but again, this is kind of a prompt for me to kind of say what I might want to put in there. So I'm going to turn on my microphone and say 5 days. I'm going to hit the next on my microphone. Now I'm on status. Getting worse. Moderate. Difficulty breathing, comma, nasal congestion, comma, cough, comma, subjective fever, comma, sore throat. Lying down at night. NyQuil. None. So now I've used my the mic with a Dragon, and I've built my HPI. And this is perfectly fine when you look at the billing components and recommendations. Even to get the high level coding, you only need 4 pieces of HPI. So we've got that with a chief complaint. We've got an onset duration, a status, a severity, some symptoms, what makes it worse, what makes it better. So we have several points, so we easily got enough. But if you look at this, in my mind, this is a very clunky, not very interesting looking HPI. And it also took me quite a while to build it. So instead, what I like to do, and I just deleted it all to start over here, is that I usually just dictate my HPI. And since I have the Dragon, this makes me so much more efficient than in the old days when I used to have to try to type it. And really, HPI is kind of one of the art pieces of medicine that we all learned how to do. And so I think that this is a good place to use our ability as a provider to build a nice story. So let me give you an example here, taking that patient we just kind of tried to do previously, and I'm just going to turn on my microphone and I'm going to dictate. This is a 46-year-old male who has had cough for the last 5 days, period. He says that it's getting a little bit worse, period. He also has stuffy nose, comma, sore throat, comma, occasionally getting short of breath, comma, and sometimes feels a little bit feverish, but he didn't take his temperature, period. It seems to get worse when he lies down, and he tried taking some NyQuil, and that made it a little bit better, period. So you can see that in a fraction of the time, I actually built quite a nice HPI. That's actually a much better story. Looks a little bit prettier, if you will, than kind of the boxed method. But from my mind, the most important thing is that it was a lot faster and easier than clicking on all those little boxes and trying to figure out what's going on. So for my money, the HPI is a good place to dictate this pretty easy to do just like that. Let's take a look at one of the other common types of HPIs you see, which is going to be someone who's coming in with chronic conditions. So when I have a patient with chronic conditions, a lot of times what I like to do is set up their problem list first. So like I could turn on the hypertension and say I'm going to do their depression and their GERD. Okay, so now this kind of reminds me what we talked about in the visit. And then when I go to do my HPI, I can just dictate it. And basically I can just dictate my kind of stream of consciousness about what's going on with their problems. I can do it that way, or I could also break the problems into individual sections, and I could say, hypertension, he's taking his medicines, next line, whatever. But for this one, I'm just going to kind of just go and talk about it. And this is really kind of how we take care of patients, is we talk about their problems, so you can make your HPI just like that. Now, here's an example. Patient is here to follow up on chronic conditions, period. Next line. Patient is tolerating high blood pressure medicines and feeling well with no chest pain, shortness of breath, or swelling in the legs, period. Patient feels mood is much improved on the Lexapro and would like to continue with that, period. He decided not to do therapy, but his mood has significantly improved, period. Next line, patient also is tolerating his omeprazole and has no longer had any reflux, period. He would like to stay on that for a little while, since when he stopped taking it, he got return of his symptoms, period. So you can see fairly quickly in a nice, normal English language, basically, I was able to make a nice long HPI. And here again, for billing purposes, even to get the high-level code, I have to address 3 chronic conditions, and it's pretty obvious that I did that. So there's his high blood pressure, the depression is in there, and the GERD is in there. So I've easily addressed my 3 chronic conditions. So the good news about Millennium is it does allow multiple types of workflows. It's certainly okay to use HPI auto text, and certainly if you have your own auto text built out, it's perfectly fine to use it. But I would encourage you to think about dictating your HPI to see if you can make it look a little bit better, but also hopefully be a little bit more efficient. Okay, so the next section is the review of systems. Now, review of systems is an interesting thing to think about in the outpatient setting. Review of systems, when people come in with a medical problem, review of systems not the most useful thing, because you think about someone who comes in with a cold. Most of the time you're not needing to review other systems. Mostly what you're documenting is the things that have to do with a cold. But maybe you want to put some review systems of their GI in here or something, so that's reasonable. But also when you think about the billing requirements, even to get a high-level code like a 99214, you only have to have 2 different systems reviewed. So my default for review of systems is to use some pretty simple things, either with an auto text or even with a drag-in auto text. So for instance, I have set up for myself my 3 dots ROS URI. So this is a big one that you could do, but is this really going to add anything to what's going on? Because constitutional about fevers and chills, I'm pretty sure that's already going to be in my HPI. Most of these things are already going to be in my HPI. And here is maybe the addition of some GI stuff and some skin stuff that maybe would add to it. But let's say that mostly that one's going to be not really necessary. So instead, I'm going to pull in my kind of minimal one by using a dragging command, ROS min. And here's my kind of minimal review of systems that I use usually for adults. And it's got constitutional negative for fever, respiratory negative for dyspnea, cardio negative for chest pain. So think about, most patients you talk about, you kind of just double check and make sure they haven't had a fever or chest pain or any shortness of breath. So this is a pretty simple type of review system that I can drop in, and it's going to cover bases and again meet all the requirements. I'm going to be able to move on pretty quickly. Now the exception to that is physicals or well visits. Well visits tend to be much more important to have the review systems, because as you think about it, a pure well visit, they don't have an illness, so there's no history of present illness. So the review of systems is much more important. This is where you spend a lot more time kind of talking to people and see if they're having something going on. Same thing for well child. So here's my review of systems for well child. So you got quite a few more systems. My adult one is even longer. But basically this is set up and it's just got some simple things. And then it's got the spot at the end if I want to add any more things. So review systems tends to be, again, something not to spend a whole lot of time on other than maybe in your physicals. Always remember, of course, if you're using an auto text, that if they do have something, one of the symptoms, you may need to go back and check it. So let's say I did a well child, but the mom said the patient had a cough. Well, if I drop this in here, I need to change this and get rid of the cough, right? Because they said the patient does have a cough. So pretty straightforward way to do your review of systems. I really spend probably 5 to 10 seconds on the review of systems on the average note, drop in one of my auto texts, make sure there's nothing inappropriate, and then move on to the next section. So moving on from review of systems, of course, we get to the physical exam or objective section right down here. And I think this is a really important section, which is going to really reflect what you actually did with the patient. And so I think it's an important thing to spend some time on. And again, I'm going to use some dictation to help me be specific. Now, there are some times you may want to use your auto text. I definitely recommend using auto text on here for physicals and well visits. I'll show you what that looks like. But, you know, again, like in the HPI, let's take a look at one example. If you're going to use a big auto text like this one for ear pain, you see how much stuff is in here. I'm going to have to click individually through here or use my microphone to go through here and kind of dictate all the different sections. And it's not real likely that each one of these sections is really germane to the patient's problem, right? So for instance, if a patient comes in with a cold, there's a lot of stuff on there that I don't really kind of need to document or is kind of double documentation. So let me show you what I tend to do for most of my patients. We'll start with something simple. I'm going to drop in PE min. So this is kind of a minimal physical exam that's just got constitutional, respiratory, cardiovascular, and psychiatric. So this is kind of the bottom baseline that I do on pretty much anyone that comes into my office. And you can see that my auto text ends with the cursor down on the next line. So as soon as I drop in my auto text, or in this case I did it with Dragon, I can continue dictating. So I can just say HEENT : tympanic membranes normal bilaterally and normal external auditory ear canals, period. Posterior oropharynx mildly erythematous but with no discharge. Nasal pharynx with mild inflammation and clear discharge. Period, next line. Neck : supple with no lymphadenopathy. So now with a little bit of dictation, I've done a pretty good job of really describing the important parts of this person's physical exam, and I've also included the other things to give me plenty of credit for whatever level I want to bill for. This is how I like to do most of my my physical exams. And you can just pretty quickly get to what you need to do. Again, you got to be careful anytime you use an auto text. So if this is someone who, you know, has a developmental problem, you may not want to say that they're looking well developed. You may want to make a little bit of change on that. But for the most part, you can use something that's relatively basic or straightforward as your base, and then add on things. I see a lot of sports medicine in my practice. This is great for that too, because again, I can just drop in the baseline and then I'll just dictate the MSK and go right to the joint that I spent a lot of time on. And basically, because I'm usually doing my dictation right after I see the patient, all these findings are pretty fresh in my mind, and it's pretty easy to dictate and get them down on paper. And again, if you look at this, this is the way you think as a provider. You think about tympanic membranes and so forth. So it's actually pretty easy to do it that way. So give it a try, see what you think. You can certainly use the big auto text and try to fill it in if you want, but I think this is a more efficient way. Now again, the exception to that is going to be when we're doing physicals. So for physical, you're going to want to use probably a longer auto text. So here's one for female physical, and I've got a lot of more stuff on here. Same basic stuff to start, but I've already built in all these other things. And again, if you're like me and you do things kind of in a routine when you do your physicals, then you can set this up and then just really easily come back in and change, you know, the no edema to trace edema in legs, you know, something like that. And I'll show you in another video how to use Dragon to help you edit text even faster. So this is a good way to really quickly document quite a lot of stuff on your well visits, is by using the auto text and then fix any details. So the last main section of your note, of course, is the assessment plan here. I've scrolled down a little bit now, and we're seeing that I've already selected these assessments, and I need to fill in a plan for these. And I usually kind of use a mixed plan for doing these. Most of the time I'm going to just quickly dictate a plan, but there are some things that I'll use an auto text for. Maybe for this hypertension, if the patient is stable, I may just quickly dictate patient remains stable on amlodipine and hydrochlorothiazide, period. Recommend continued present management and monitoring, and come back in 3 months for a recheck. So it's a pretty simple way of doing it, and this is like normal medical jargon and stuff, and this is really easy for anyone to read, mostly for myself, right? Because if I see this patient back in 3 months and I look at this note, I want to know what I was thinking, so I don't have to kind of recreate my frame of mind. So it's really pretty straightforward. I can do that. Remember that if I order something to go with it, so let's say I come to my new orders component up here and I order some labs to go with this patient's hypertension. Let me sign it off on the hypertension. Remember that will automatically be attached to that section here. So one of the things that I used to do was to dictate in here, I'm going to check a CBC and a CMP and whatever, when there's no reason to do that because that's already attached right here. If you feel like you want to, make sure you're getting credit, you can dictate check labs, but there's really no reason to repeat the specific labs because they're already here. And this goes on your note as well. So let's take a look at what it might look like to use an auto text. So for instance, for GERD, I have a auto text for GERD built. It's got 3 dots and then plan and then GERD. And so this is a series of things I've created a long time ago that I brought forward with me. And so this is, again, one of the things that I tend to do in general for people with GERD is I have the same kind of behavioral discussion with them, talking about certain things. So because I have the similar approach to treating patients, it actually makes it easy to have a similar approach to documenting how I treated that patient. So I already know I'm going to treat them with omeprazole or whatever, so I've already got that built into my auto text. And then if we make some changes in it, maybe we say we're going to wait 6 weeks or something, then I can just make that change here. But relatively easily I can drop all this in. The other example is if you could imagine this was a physical. Definitely you want to use some auto text for physicals. So my favorite ones are these auto texts here for the adults. And what I like about this for the physicals is it helps me remember to kind of check off all the things that I want to do for my patient's physicals, right? So I can use my arrow on my microphone, up to date. And basically I can just move right through these and just document what I did, and it helps me remember. So every now and then I'll get through here and I'll be like, oh crap, I forgot to order this patient's DEXA. And that will prompt me to go ahead and get it done and take care of it. These are, of course, the things you've probably already done. This is why the patient is here for the physical. So you've probably already thought about these things and taken care of them. But it's really easy to move through, document them. And then again, when you see them back and you look back at their old note, it's really easy to see this. So you can even dictate something like for the PAP test and just say, instead of just saying it's up to date, you could say next one is due 2023. That way, when you look back in 2023 and you see your note, that'll prompt you, hey, this person is due for their PAP test. So these are the ways I like to go through my assessment and plan. Most of the time I dictate, because again, dictating has really made me more efficient. I'll use my auto text for some of the particular types of things where I do similar advice to the patients over and over again, like a cold or back pain or reflux, and then definitely using auto text for well visits, well childs, and adult physicals.